Hello everyone, I am Dr. Nilendu Sarma, consultant dermatologist practicing in Kolkata and talking on behalf of DermaVidya. Today I will be discussing about nail health uh, and standard nail care and also some diseases that are prevalent, some management strategies and some basic day-to-day care. What should we do, what should not do about the nail care. Nail is an important organ and it has multiple important functions. But at the same time, it is an organ of beauty. We should know that nail means this hard structure, but surrounding the nail there is a skin. And this nail develops from its root that lies inside the skin here. So anything that damages the nail root will result in formation of a deformed nail. Regarding regular care of the nail, the most common cause that damages the nail among us, mostly among the females, is repeated contact with the water. Detergent, any harsh chemical will add to the problem, but continuous contact with simple water is the major problem. Continuous contact with the water results in water penetrates inside the skin and it remains there. It makes the skin moist, and we know anything moist in our body can lead to secondary infection with the fungus, most commonly the candida infection. This leads to swelling of the skin surrounding the nail, and this is very common among the housewives who are always in contact with the water in their kitchen or other place. Initially, this leads to mild swelling and mild pain, but if they ignore at this stage, it results in large swelling. Sometimes it needs to be operated. And sometimes it doesn't become so acute. It slowly continues to soil and damage the root of the nail. Then nail becomes deformed because the root has been damaged. It is very difficult to grow a normal nail when the root has been damaged. So in this situation, the primary thing that we need to do is to reduce the contact with the water. Keep the nail dry. Whenever they come in contact with the water after the work, they have to make the area dry with some dry cotton cloth. Second is normal skin care, normal nail care. It is important to know that normal nail polish can have some chemicals that are harmful for them. And some persons who are working in a parlor or a nail salon, they come regularly in contact with these chemicals like toluene, like dibutyl phthalate. These are very harsh chemical. These damages the nail. Not only the person who is using the on their nail, the person who is using as a salon who works in the salon, their skin is also getting damaged. Nail polish, the gel type nail polish, often contains acrylates. Acrylate is a chemical that damages the nail. The nail remover that contains mostly the acetates also damages the nail. But since the nail is an organ of beauty, female will definitely use some or other things to beautify their nail. But important thing must be known to everybody that overuse of these things can damage the nail. Second is infection. That is a disease. I have already said the candida infection that is common among the housewives. There can be other infections like the ringworm that we often develop on the skin. the same organism can infect the nail, then this hard nail or the skin inside or surrounding the nail can also be affected. And if we ignore the nail at this stage, then again nail root can be damaged and nail can be deformed permanently. Third, some bacteria can affect the nail, like Pseudomonas. Although rarer than the fungal infection, that still is common. These are all need to be diagnosed as soon as possible because early treatment can only help to get a normal nail. When the nail root is damaged, it may not come with lot of treatment. Since nail progress or grows in a slower rate than the skin, so the treatment also takes a longer time. During this treatment, months, 4 months, 5 months, 6 months, or even for the toenail, even longer time is required. So during this time, not only the treatment, but protection and prevention and avoidance, all the factors that has caused nail damage has to continue. Many patients do not do that. They start treatment, they want response in few days, and if they don't find that, they stop the treatment. That is more harmful. So it is important to counsel the patient that treatment will continue for few months. Sometimes we need surgical options also to remove the nail, and then only the medical treatment can be helpful. Yes, this is about regular nail care. And one more thing, the nail polish that we use on the nail plate, if comes in contact with the other parts of the body, like touching the eyelid, touching the skin, can also be transferred to that area. It may not cause any allergy on the nail because it is very strong and thick, but it can cause allergy on the eyelid, on the other parts of the body. So again, not everybody will develop allergy to the same molecule, same chemical, but somebody may develop. So this is also important to know. And this is all about routine nail care, some diseases, common diseases, their treatment and prevention. I hope you will learn at least something from my video. Thank you.
For more such videos, visit or log into dermavidya.com.